Welcome to PrepPass. Here are 50 real-life and health insurance license practice questions with answers for 2026. Read each question, then try to answer before the 5-second timer runs out. For the full free practice test, just search preppass.org. Let's begin. Question 1. A consumer enrolls in a California Health Maintenance Organization, HMO. Which state agency has primary regulatory authority over that HMO? A. California Department of Insurance, CDI. B. California Department of Managed Healthcare, DMHC. C. California Department of Public Health, CDPH. D. Centers for Medicare and Medicaid Services, CMS. The correct answer is B. Under the Knox-Keene Healthcare Service Plan Act, California HMOs are regulated by the Department of Managed Healthcare, DMHC, not the CDI. The CDI regulates indemnity health insurance and PPO products, but full-service HMOs fall under DMHC. Question 2. Under the Federal Affordable Care Act, a non-grandfathered group health plan must cover recommended preventive services with A. A separate $100 deductible. B. The same co-insurance applied to specialty care. C. No cost sharing to the in-network member. D. A flat $25 copayment per visit. The correct answer is C. Section 2713 of the Public Health Service Act, added by the ACA, requires non-grandfathered plans to cover certain preventive services, such as immunizations, screenings, and annual wellness visits, without imposing any deductible, copayment, or co-insurance when delivered in-network. Question 3. An employee voluntarily quits her job at a private company with 60 employees. Under Federal COBRA, the maximum continuation coverage period available to her is A. 18 months. B. 29 months. C. 36 months. D. 60 months. The correct answer is A. Voluntary or involuntary termination, other than for gross misconduct, and reduction in hours are qualifying events that entitle a covered employee to up to 18 months of COBRA continuation. Question 4. CalCOBRA differs from Federal COBRA primarily because it A. Provides longer benefits to employees of large employers. B. Replaces Federal COBRA for all California residents. C. Eliminates the employee premium contribution requirement. D. Extends continuation rights to employees of small employers with 2 to 19 employees. The correct answer is D. Federal COBRA applies only to employers with 20 or more employees. CalCOBRA fills the gap by requiring continuation coverage from California group health plans of small employers with 2 to 19 employees, generally for up to 36 months total. Question 5. To be eligible to contribute to a health savings account, HSA, an individual must be covered by A. Any employer-sponsored health plan. B. A high-deductible health plan, HDHP, with no disqualifying other coverage. C. A health maintenance organization with a $0 deductible. D. Medicare Part A or Part B. The correct answer is B. Section 223 of the Internal Revenue Code requires an HSA-eligible individual to be covered under a qualifying HDHP and to have no other disqualifying health coverage. Enrollment in Medicare disqualifies a person from making new HSA contributions. Question 6. Under the ACA Metal Tier Framework, a silver plan must cover what approximate percentage of the average enrollee's covered medical costs, its actuarial value? A. 60%. B. 65%. C. 70%. D. 80%. The correct answer is C. The ACA defines 4 metal tiers by actuarial value: bronze at approximately 60%, silver at 70%, gold at 80%, and platinum at 90%. Catastrophic plans are separate and available only to certain enrollees. Question 7. A 45-year-old applicant with a history of diabetes applies for an individual ACA-compliant health policy through Covered California. The insurer may, A, not deny coverage or charge a higher premium based on the diabetes. B, exclude diabetes-related claims for the first 12 months. C, charge a 50% surcharge for the pre-existing condition. D, deny the application outright. The correct answer is A. Since 2014, the ACA has prohibited individual and group market insurers from denying coverage, charging higher premiums, or excluding benefits based on any pre-existing condition. Question 8. Under the ACA, a group health plan that offers dependent coverage must make that coverage available to an enrolled employee's adult child until the child reaches age A, 19, B, 21, C, 23, D, 26. The correct answer is D. The ACA requires plans offering dependent coverage to allow enrolled adult children to remain on a parent's plan until age 26, regardless of marital status, residency, financial dependence, or student status. Question 9. Which of the following is not one of the 10 essential health benefits categories that an ACA-compliant individual or small group plan must cover? A. Maternity and newborn care. B. Adult dental and vision services. C. Mental health and substance use disorder services. D. Prescription drugs. The correct answer is B. The 10 essential health benefits include ambulatory services, emergency services, hospitalization, maternity/newborn care, mental health/substance use, prescription drugs, rehabilitative services, lab services, preventive/chronic disease management, and pediatric, not adult, services including dental and vision. Question 10. A key structural difference between a traditional HMO and a preferred provider organization, PPO, is that the HMO, A, requires a primary care physician, PCP, to coordinate care and generally has no out-of-network benefits except emergencies. B allows members to see any specialist nationwide with no referral or network limits. C always pays 100% of charges without any deductible or copayment. D is regulated only by federal Medicare rules. The correct answer is A. A core HMO feature is the gatekeeper PCP who coordinates and authorizes referrals to specialists. HMOs typically only pay for in-network care, with emergencies as the main exception. Question 11. An exclusive provider organization, EPO, plan is best described as a plan that A. pays for any provider nationwide with no network restriction. B. requires a PCP gatekeeper and pays partial benefits out of network. C. combines Medicare and Medicaid benefits. D. limits non-emergency coverage to in-network providers but typically does not require a PCP referral. The correct answer is D. An EPO restricts non-emergency benefits to the in-network panel of providers, much like an HMO, but unlike a traditional HMO, it generally does not require a PCP referral to see specialists. Out-of-network non-emergency care is usually not covered. Question 12. Which type of managed care plan combines features of an HMO, PCP gatekeeper, with limited out-of-network coverage at a higher cost share? A. EPO, exclusive provider organization. B. POS, point of service. C. A traditional indemnity plan. D. Self-funded reinsurance plan. The correct answer is B. A point of service, POS, plan blends HMO and PPO features. The member selects a PCP who manages and refers care, but unlike a pure HMO, the plan also pays a reduced benefit when the member uses out-of-network providers. Question 13. Which of the following best defines coinsurance? A fixed dollar amount the insured pays before benefits begin. B. A flat fee paid at each office visit. C. A percentage of covered charges the insured pays after the deductible is met. D. A separate policy that pays only the deductible. The correct answer is C. Coinsurance is the percentage share of covered expenses the insured pays, for example, 20%, after the deductible has been satisfied. The plan pays the remaining percentage. Question 14. The Federal Health Insurance Portability and Accountability Act, HIPAA, of 1996 primarily addresses which of the following? A. Protection of individually identifiable health information and continuity of group health coverage. B. Federal funding of Medicaid expansion in California. C. The structure of covered California subsidies. D. Mandatory enrollment of all individuals in Medicare Part A. The correct answer is A. HIPAA was enacted in 1996 to standardize electronic health transactions, protect the privacy and security of individually identifiable health information, PHI, and improve portability and continuity of group health coverage when workers change jobs. Question 15. Covered California is best described as A. A self-insured health plan operated by the state of California. B. A federal Medicare Advantage program. C. California's state-based ACA health insurance exchange offering qualified health plans and premium subsidies. D. A private association that sells short-term medical coverage. The correct answer is C. Covered California is the state-operated Affordable Care Act exchange, marketplace, where individuals and small employers can compare and enroll in qualified health plans and where income-eligible enrollees receive federal and state premium assistance. Question 16. As of 2026, California residents who go without minimum essential health coverage may face which of the following? A. Only the federal ACA shared responsibility penalty. B. A California state individual shared responsibility penalty assessed through the state income tax return. C. Suspension of their California driver's license. D. Automatic enrollment in Medicare. The correct answer is B. The federal individual mandate penalty was reduced to $0 starting in 2019, but California enacted its own individual shared responsibility penalty effective January 1, 2020. Question 17. A flexible spending account, FSA, used to pay for qualifying medical expenses is best described as A. An employee-owned account that earns interest tax-free for life. B. A federally administered program that pays Medicare premiums. C. An account funded only by the employer that the employee may roll over without limit. D. A pre-tax employee salary reduction account subject to a use it or lose it rule, with only limited carryovers allowed. The correct answer is D. A health FSA established under an IRC Section 125 cafeteria plan is funded with pre-tax employee salary reductions and any employer contributions. Unused balances are generally forfeited at year-end, although plans may allow a limited carryover or grace period. Question 18. A health reimbursement arrangement, HRA, is most accurately described as A. An employer-funded, employer-owned arrangement that reimburses employees for qualifying medical expenses. B. An employee-funded savings account that earns interest like an HSA. C. An optional rider that replaces COBRA coverage. D. A type of long-term care insurance contract. The correct answer is A. An HRA is funded solely by the employer, not by employee salary reductions, and is owned by the employer. It reimburses employees, tax-free, for qualified medical expenses up to the amount the employer allocates, under rules in IRC Section 105 and IRS guidance. Question 19. Balance billing in a health plan context refers to A. The insurer's annual reconciliation of premiums. B. A bonus payment to in-network providers for meeting quality targets. C. A provider billing the patient for the difference between the provider's full charge and the amount the insurer pays. D. The patient's monthly premium bill. The correct answer is C. Balance billing occurs when a provider bills the patient for the difference between the provider's total charge and the amount the insurer pays as the allowed amount. Question 20. An employer that pays employee medical claims directly out of its own funds, rather than purchasing a fully insured group policy, is using A. A fully insured plan. B. A self-funded, self-insured plan, often paired with stop-loss/reinsurance. C. A Medicare Advantage plan. D. A guaranteed renewable individual plan. The correct answer is B. In a self-funded, self-insured plan, the employer assumes the financial risk for claims and typically buys stop-loss reinsurance coverage that caps the employer's exposure per individual claim and on an aggregate annual basis. Question 21. A major medical health insurance policy is best characterized by A. Broad coverage for inpatient and outpatient services with a deductible, coinsurance, and out-of-pocket maximum. B. Coverage limited to dental and vision benefits only. C. Coverage that pays only for accidental injuries, not illness. D. A fixed daily indemnity benefit regardless of actual medical charges. The correct answer is A. Major medical insurance provides broad coverage for hospital, surgical, physician, and outpatient care subject to plan design features such as a deductible, coinsurance, copayments, and an annual out-of-pocket maximum. Question 22. A health plan that requires the member to pay $30 every time they visit their primary care doctor is using which cost-sharing tool? A. Deductible. B. Coinsurance. C. Out-of-pocket maximum. D. Copayment. The correct answer is D. A copayment, copay, is a fixed dollar amount the member pays at the time of service, regardless of total charges. Question 23. With respect to essential health benefits on an ACA-compliant plan, an insurer may impose A. A $1 million lifetime cap. B. A $250,000 annual cap on hospital benefits. C. No annual or lifetime dollar limits on essential health benefits. D. Only an annual cap, but no lifetime cap. The correct answer is C. The ACA prohibits both annual and lifetime dollar limits on essential health benefits. Question 24. A spouse of a covered employee loses dependent coverage because of divorce. Under federal COBRA, the maximum continuation coverage period available to the divorced spouse is A. 18 months. B. 36 months. C. 60 months. D. There is no continuation available for divorced spouses. The correct answer is B. Divorce or legal separation is a qualifying event that affects spouses and dependent children. Question 25. Which California law sets the standardized required and optional provisions that every individual accident and health policy must follow? A. The Holden-Bagley Act. B. The Knox-Keene Healthcare Service Plan Act. C. The Uniform Individual Accident and Sickness Policy Provisions Law, UPPL. D. The California Long-Term Care Insurance Act. The correct answer is C. The UPPL, codified beginning at Cal. INS Code Section 10350, divides ANH policy language into required and optional provisions. Knox-Keene governs HMOs, Holden-Bagley addresses life and disability, the LTC Act covers long-term care contracts. Question 26. Under the time limit on certain defenses provision, after how many years from issue can the insurer no longer rescind an ANH policy for a non-fraudulent misstatement on the application? A. 1 year. B. 2 years. C. 3 years. D. 5 years. The correct answer is B. The incontestability window for individual ANH policies is 2 years from the date of issue. After that, only fraudulent misstatements remain contestable. Ordinary errors no longer support rescission. Question 27. An individual ANH policy is paid on a monthly mode. What is the length of the required grace period? A. 10 days. B. 7 days. C. 20 days. D. 31 days. The correct answer is A. The standard grace period is 7 days for weekly mode, 10 days for monthly mode, and 31 days for all other modes. Coverage continues during the grace period. Question 28. An ANH policy is reinstated on June 1st. The insured suffers a covered injury on June 2nd and is diagnosed with a covered sickness on June 7th. Which losses will the reinstated policy cover? A. Neither the injury nor the sickness. B. Only the sickness. C. Only the injury. D. Both the injury and the sickness. The correct answer is C. A reinstated policy covers accidental injuries from the date of reinstatement, but sicknesses are only covered if they begin more than 10 days after reinstatement. The June 7th sickness falls inside the 10-day exclusion window. Question 29. Within how many days after a covered loss must written notice of claim be given to the insurer under the standard required provision? A. 10 days. B. 20 days. C. 30 days. D. 60 days. The correct answer is B. Notice of claim must be given within 20 days after the occurrence or commencement of any loss, or as soon as reasonably possible. After receiving notice, the insurer must supply claim forms within 15 days. Question 30. After receiving a notice of claim, within how many days must the insurer furnish claim forms to the claimant? A. 5 days. B. 7 days. C. 10 days. D. 15 days. The correct answer is D. The insurer must supply claim forms within 15 days after receiving notice of claim. If it fails to do so, the claimant may submit any written proof describing the occurrence, character, and extent of loss. Question 31. Written proof of loss must generally be furnished to the insurer within how many days after the date of loss? A. 20 days. B. 60 days. C. 90 days. D. 180 days. The correct answer is C. Proof of loss must be furnished within 90 days after the date of loss, or after the end of each disability period for periodic disability benefits. Late proof is still acceptable if it was not reasonably possible, generally no later than 1 year. Question 32. Under the legal actions provision, an insured cannot start a lawsuit on the policy until at least how long after written proof of loss has been furnished? A. 60 days. B. 90 days. C. 6 months. D. 1 year. The correct answer is A. The legal actions provision bars suits sooner than 60 days after proof of loss has been furnished and later than 3 years after proof of loss was required. This gives the insurer time to investigate and pay. Question 33. What is the maximum number of years after written proof of loss was required during which the insured may bring a legal action on the policy? A. 1 year. B. 2 years. C. 3 years. D. 5 years. The correct answer is C. The legal actions provision sets an outside limit of 3 years from the time proof of loss was required. After that, the insurer has a complete defense to the suit. Question 34. When an insurer discovers that an insured's age was misstated on an A&H application, what is the typical result under the optional misstatement of age provision? A. The policy is rescinded from the date of issue. B. The benefit or premium is adjusted to what the correct premium would have purchased. C. The insurer must refund all premiums paid. D. The policy continues unchanged because age has no effect on A&H. The correct answer is B. The misstatement of age provision is a corrective remedy, not a voiding remedy. The benefit, or premium, is adjusted to what the correct age premium would have purchased. The contract stays in force. Question 35. Which renewability classification gives the insured the strongest protection by preventing the insurer from raising the premium or refusing renewal during the contract period? A. Non-cancelable. B. Guaranteed renewable. C. Conditionally renewable. D. Optionally renewable. The correct answer is A. A non-cancelable policy locks both the premium and the renewal right. Guaranteed renewable lets the insurer raise the premium by class. Conditionally and optionally renewable allow non-renewal under stated or any conditions. Question 36. Under a guaranteed renewable individual health policy, what may the insurer do at renewal? A. Cancel the policy for poor claims experience. B. Raise the premium for an entire class of insureds, but must still renew. C. Raise the premium only for that individual insured. D. Refuse to renew any time during the contract period. The correct answer is B. Guaranteed renewable means the insurer must renew up to the stated age, cannot cancel except for non-payment, and may only adjust premiums on a class basis, never against a single insured. Question 37. What is the primary purpose of coordination of benefits (COB) provisions? A. To increase the total benefits payable to an insured with multiple plans. B. To void any secondary policy after a primary policy pays. C. To prevent an insured from collecting more than the actual loss when multiple plans cover the same expense. D. To require all insurers to share premiums equally. The correct answer is C. COB rules prevent overinsurance. They order multiple plans into primary and secondary roles so the combined payments do not exceed 100% of the actual covered expense. Question 38. A hospital indemnity rider pays benefits in what manner? A. Reimbursement of actual hospital charges after billing. B. A fixed dollar amount per day of hospital confinement, regardless of actual charges. C. A single lump sum on first diagnosis of any illness. D. A monthly disability income equal to the insured's salary. The correct answer is B. Hospital indemnity coverage pays a stated daily, weekly, or monthly cash amount during a covered hospital stay. The cash is paid to the insured and is not tied to the actual hospital bill. Question 39. Tomas adds a critical illness rider to his policy. 6 months later he is diagnosed with a covered heart attack and survives. How is the benefit typically paid? A. The daily indemnity for each day of hospitalization. B. Reimbursement of medical expenses up to the rider limit. C. A monthly disability income for the rest of his life. D. A lump sum cash benefit on first diagnosis of the covered condition. The correct answer is D. Critical illness, also called dread disease. Riders pay a single lump sum upon first diagnosis of a listed condition such as heart attack, stroke, cancer, kidney failure, or major organ transplant. The insured may use the money for any purpose. Question 40. What is the elimination period on a disability income policy? A. A deductible expressed in days during which the insured must be disabled before benefits begin. B. The maximum number of days benefits will be paid in a lifetime. C. The waiting period before a new sickness is first covered after issue. D. The number of days the insurer has to pay each monthly benefit. The correct answer is A. The elimination period is the time-based deductible at the front end of a disability claim. Longer elimination periods, such as 90 or 180 days, lower the premium because the insurer pays for fewer short claims. Question 41. Under the time of payment of claims required provision, periodic disability income benefits that have accrued must be paid at least how often during the period the insurer is liable? A. Weekly. B. Monthly. C. Quarterly. D. Annually. The correct answer is B. Accrued periodic disability income benefits must be paid at least monthly during the period of liability. Any unpaid balance at the end of liability must be paid immediately upon receipt of due written proof. Question 42. Which of the following actions by an insurer would constitute an unfair claims settlement practice under California law? A. Requesting reasonable proof of loss before paying a claim. B. Promptly investigating a claim after notice is received. C. Failing to acknowledge and act reasonably promptly upon communications with respect to claims. D. Offering settlement based on a properly conducted investigation. The correct answer is C. Section 790.03, H2. Lists failing to acknowledge and act reasonably promptly on claim communications as one of the enumerated unfair claims settlement practices. The other options describe lawful, expected insurer conduct. Question 43. Which of the following describes rebating? A. Reducing premium by applying earned policy dividends. B. Offering a group discount lawfully filed in the rate plan. C. Sharing commission with a co-licensed agent of record. D. Returning part of the agent's commission to the applicant as an inducement to buy. The correct answer is D. Rebating is offering any valuable consideration outside the policy as an inducement to buy. California now permits limited, non-discriminatory rebates if disclosed and offered uniformly, but the textbook definition tested here is the unlawful inducement form. Question 44. Under California law, before transacting any insurance business in the state, a person must A. Pass a background check only. B. Hold a license issued by the insurance commissioner. C. Register with the Department of Managed Healthcare. D. File a fictitious business name statement. The correct answer is B. Section 1631 makes it unlawful to solicit, negotiate, or effect insurance in California without first being licensed by the Commissioner. A background check, live scan, is part of the application but does not by itself authorize transacting insurance. Question 45. Generally, how many hours of continuing education must a resident life-only or accident and health agent complete during each 2-year license period after the first renewal? A. 12 hours, including 1 hour of ethics. B. 20 hours, including 2 hours of ethics. C. 24 hours, including 3 hours of ethics. D. 40 hours, including 4 hours of ethics. The correct answer is C. Section 1749 sets the standard renewal CE requirement at 24 hours per 2-year period, of which at least 3 hours must be ethics. Newly licensed agents have an enhanced front-loaded requirement under Section 1749.3. Question 46. A newly licensed California life-only agent must complete how many hours of CE during the first 2 years of licensure? A. 12 hours. B. 15 hours. C. 20 hours. D. 25 hours. The correct answer is D. Under Section 1749.3, newly licensed life-only or ANH agents must complete 25 hours of CE within the first 2 years, including pre-licensing topics carried into early practice. After that, the 24-hour biennial requirement of Section 1749 applies. Question 47. Premiums collected by an agent from a policyholder, before being remitted to the insurer, are held by the agent in what capacity? A. Fiduciary capacity, in a premium trust fund. B. A personal capacity, with no special duty. C. Joint capacity with the policyholder. D. As a loan to the insurer. The correct answer is A. Section 1733-1734 require licensees to hold all funds received from premiums in a fiduciary capacity, typically in a separately identifiable premium trust fund. Commingling with personal funds is grounds for license discipline. Question 48. Under California replacement regulations, when an applicant indicates a replacement is involved, the agent must A. Provide only a verbal disclosure of differences. B. Provide a written notice regarding replacement and submit it to both the new insurer and the existing insurer. C. Wait until the new policy is delivered before notifying the existing insurer. D. Notify the Commissioner directly within 15 days. The correct answer is B. California's replacement regulations, 10 CCR sections 2534+, require the agent to provide a notice regarding replacement signed by the applicant and submit copies to both insurers so the existing insurer can preserve the applicant's right to conserve the policy. Question 49. An agent wants to schedule an in-home appointment with a 78-year-old prospect to discuss life insurance and annuity products. What advance notice must the agent provide? A. No advance notice is required if the prospect calls first. B. 12 hours written notice. C. 24 hours written notice that states the purpose of the meeting and the right to end the meeting at any time. D. 72 hours written notice with the Commissioner's approval. The correct answer is C. Section 789.10 protects seniors, 65+, by requiring written notice at least 24 hours before an in-home appointment, disclosing the agent's identity, products to be discussed, and the consumer's right to end the meeting or have a third party present. Question 50. The free look, right to examine, period for an individual life insurance policy issued to a person age 65 or older in California is A. 10 days. B. 15 days. C. 20 days. D. 30 days. The correct answer is D. Section 10127.10 requires a 30-day free look for individual life and annuity policies sold to seniors 65 plus. Standard adult policies generally carry a 10-day free look. That's all 50 questions. Want the full insurance practice test with hundreds of questions, completely free? Just search PrepPass.org. Good luck on your exam.